Secretary of State Hillary Clinton's out of the hospital tonight after days of treatment for a blood clot near her brain. News 4's Jackie Beckford is live in Chappaqua, where Mrs. Clinton is now resting at home. Jackie?
Chuck, the Secretary of State was seen on her feet at the hospital before she was released today. Now, a doctor we spoke to says her quick release from the hospital is a sign that she'll make a full recovery, but she'll have to do something that probably comes very foreign as someone who's known as the most frequent flyer in the administration, and that's stay grounded in the coming weeks. After 3 days of treatment for a blood clot in a vein behind her ear, Secretary of State Hillary Clinton left New York Presbyterian Hospital Wednesday night. Mrs. Clinton headed home to Chappaqua to continue her recovery.
It's really great news that she's home.
Dr. Ezriel Kornel, a neurosurgeon with Northern Westchester Hospital, did not treat Mrs. Clinton, but says the Secretary of State's quick release points to a full recovery.
The fact that she's going home so quickly strongly indicates that she did not have a stroke or a significant hemorrhage in the brain.
Seen here with her husband and daughter moving about the hospital campus earlier in the day, the Secretary of State, known for being the most high-profile frequent flyer in the administration, visiting 112 countries and racking up more than 1 million miles, will likely have to stay grounded for the near future.
Certainly for the time being, for at least a couple of weeks, you wouldn't want her to be doing much traveling in airplanes. You don't want much of the change in air pressure. You don't want her to get dehydrated.
Dr. Kornel says Mrs. Clinton will also have to keep physical activity to a minimum to prevent hemorrhaging and remain on blood thinners until the clot subsides. This is not Mrs. Clinton's first blood clot. In 1998, then First Lady had a clot behind her knee, also treated with blood thinners.
Well, some people do clot more easily. Some people have hypercoagulable states for a variety of reasons. But also she travels a lot, and she sits in airplanes. That's a setup for a clot.
Clinton's spokesman says she is happy to be back home and eager to get back to work, though the Secretary of State has been talking with staff members and keeping up with her international counterparts during her hospital stay. Now, Dr. Kornel says Mrs. Clinton will also have to stay away from dark leafy green vegetables and cranberry juice, as they could interfere with her blood thinners effect. In Chappaqua, Jackie Beckford, News 4 New York.
Jackie, thank you.